very much, Lauren. And on behalf of the World Bank Cities Resilience Program, welcome everyone. My name is Uri Reich, and I'm a senior urban specialist in the South and East regions of the bank. This is our 27th series in the Cities on the Frontline. And today we will focus on the topic of predicting and monitoring hotspots and understanding what are the risks for vulnerable communities. With some cities appearing to be recovering, others continue to experience a rise in infections. Cities could anticipate and prepare for emerging hotspots, especially those with high concentration of poor and vulnerable communities. The question is then, how can cities better understand and predict emerging hotspots? And how can they target support to vulnerable communities? These are difficult questions, but today we have two excellent speakers that will shed some light on this challenging topic. We have Somik Lall, who is the World Bank Global Lead for Territorial and Spatial Development and lead urban economist in the Global Practice for Urban, Disaster Risk, Resilience, and Land. Somik joined the World Bank in 1999, and today he is a recognized expert on job creation and productivity in cities, development of lagging areas, and enhancing economic outcomes with transport connectivity, and advises national and subnational governments on key policy issues. Somik has led the World Bank Global Research Program on Urbanization and Spatial Development, and previously funded the Urbanization Reviews Program. He leads a global solution group that focuses on developing spatially coordinated multi-sector investments to support development of specific areas. The group is actively engaged in 42 countries worldwide. We also have the privilege of having with us today Dr. Gabriela Mena, who is the CEO of Prevention and Health Promotion with the Ministry of Health in the state of Jalisco in Mexico. Gabriela is a medical doctor, and previously she played different roles at the Ministry of State Coordinator of Epidemiology in the Epidemiology Department. So the discussion will follow a panel structure. There will be 2 rounds of questions that will take about 30 to 40 minutes, and then we'll open for questions from the public. Please ask your questions in the Q&A section of the WebEx. With this, let me start by asking Somik. Somik, if you can please share with us what you have observed in terms of the relationship between economic geography and contagion risk. You have also been directly engaged in the development of a tool for predicting contagion risks for hotspots, and will be eager to learn from you how the tool actually works. So without further ado, over to you, Somik. Thank you.
Thank you very much, Uri, and good evening to all our colleagues and friends who are joining from Asia, and good morning and a good day to folks who are joining from other parts of the world. I will take, Uri, I think you raise a really important question, and what I'll do is perhaps, if you allow me, share some slides that can help us, help me make some of the key points. So what I'll do in the next 7 minutes is to discuss some of the work we are doing at the World Bank on predicting COVID-19 hotspots. And I feel very fortunate to have engaged with several city leaders in taking this approach to helping city leaders solve some of the pressing problems they're facing today. Let me start this conversation by trying to debunk an urban myth. And the urban myth is this, that the dense cities are hotbeds of contagion, and that urban proximity is a key facilitator in the spread of COVID-19. But let me assure you, friends, that this is a myth, because it falsely conflates physical proximity with economic density. And you know, as city leaders, you know that the risk of contagion increases when neighborhoods really lack the physical structures and amenities that enhance livability, and where residents have no option but to go out every day in search of jobs, in search of services. But if a neighborhood has ample housing, they've got good water supply, sanitation, basic drainage, and public space, there's absolutely no reason why proximity should lead to contagion. So let me use New York City as an example here. So if you recall March or April, that seems like an age, almost ages ago, a lot of focus around the world, if you turned on channels like CNN, were on the downsides of New York City's density. And you saw on TV that there were these pictures of patients lined up outside Elmhurst Hospital, which is in Queens, which were overwhelmed with COVID-19 cases. And these are pictures that are ingrained in minds of millions of people worldwide. And at that time, the borough of Queens was the hotbed of contagion. So I was speaking to some colleagues and we asked ourselves, okay, what is it about Queens, which is much less densely populated than the borough of Manhattan, as you see in the chart in front of you? So what you see is that in Queens, people are living in crowded accommodations with multi-generational families. In Manhattan, you have public health investments, decent infrastructure, and outdoor space. So this generalization that density is a bad thing is just an urban myth. We should be focusing, I think, colleagues in working in cities, we should be focusing on the economic geography of a neighborhood, of a city, of a region, not just the physical geography, not just the physical density. And as in New York, these stark differences in economic geography have been seen to be linked with COVID-19 cases around the world. I was born and I lived a lot of my years in Mumbai, and cities like Mumbai are struggling today with the coronavirus, and other developing country cities, they're Manila, Cairo, and Nairobi, they all are struggling to manage the spread of the coronavirus. And here a major concern is economic geography. A large share of the city residents in Africa and Asia still live in slums and informal settlements, where cramped living conditions and inadequate public space, especially water and sanitation, the lack thereof, can exacerbate contagion. So to respond to this crisis, at the World Bank, my team and I, we developed a methodology that can help city leaders like yourselves answer one question. And that one question is that if I have limited civic resources, how do I allocate them most effectively to reach the most vulnerable in my city? And when we worked on this methodology, it was, say, late March, and people really didn't have a clue of how the coronavirus was going to spread. Everyone was making wild guesses. So we said, what do we really know that can get us something quick, that can be used by cities, and can be reasonably, and I use the word here intentionally, reasonably accurate? So we decided there are three things we want to do. One, we need to know where people live, and we need to figure this out very, very quickly. So we use satellite data from global open source data sets. Second, we wanted to know, how do they live? Do they have enough floor space at home? So we calculated floor space and got the data from OpenStreetMap on the location of water points and public toilets. In addition, some cities that we identified, like we are working in Metro Manila now, and thanks to the amazing team in the local government of Manila who has been collaborating with us, and we got information on wet markets. So we asked the question, how easy or how difficult would it be for people to stay at home? And if they were to stay at home, what's the risk of contagion? So to put it all together, we developed a very simple algorithm that allowed us to calculate the number of people who would not be able to socially separate, they would not be able to have 2 meters between them. And we came up with these hotspots, then even under the most rigid safety measures, there's a number of people who have a risk of exposure. So here's what the picture looks in Mumbai. And Mumbai is personally of interest to me because that's where I'm from. And just think for a moment, the slums of Dharavi, which is one of the most densely populated slums in the world. They face a triple challenge of extremely high population density, very limited floor space, scarcity of infrastructure, public space, and amenities. Now just add to this the mind-boggling fact. There are 68,000 people packed together on 1 square kilometer of land without toilets, without taps, at home. So what you see here, the picture in front of you is a little dated, but it looks at Mumbai's containment zones as of May 9th, overlaid with predicted hotspots that we did. And these containment zones are basically identified by the Mumbai Municipal Corporation based on the number of active cases where stringent measures have been taken to limit contagion. And see, over 1/3 of the zones are located in our predicted hotspots. And at that time, India's testing rates weren't very high, but I think if testing rates were better, you'd see much more accurate predictions. Let me end with one example on how we are using some of these hotspots, how you in cities are using these hotspots. So I've been really fortunate that we've been working with about 40 cities worldwide on having city leaders use these hotspots. An example here in front of you is Kinshasa. It's in the Democratic Republic of Congo, and it's one of the largest cities in Africa. And here at the World Bank, we are trying to work with, or we are working with our counterparts in the government at the national level and subnational level to help the government's multi-sectoral response plan to COVID-19, which includes, very importantly, an emergency cash transfer program in Kinshasa. And here, the government's interest is to identify about 250,000 beneficiary households, and they don't have a poverty map, they don't have a social registry, and they have a very weak digital payment ecosystem. So this predictive tool is now being used by our counterparts, and this predictive tool has data on population and building heights, so you can really look at these predicted hotspots for COVID-19 transmission. And what we do here is, of course, adjust the densities based on floor space, and we complement it with neighborhood characteristics, including risk of flooding, building density, and access to jobs. And what the selection is doing for spatial targeting is to choose or prioritize cash transfer and cash support to the most vulnerable and the most populated neighborhoods in the city. So this is just like one example, but Uri, let me take a pause now, and I can come to other examples as we go through the conversation. Thank you.
Thank you so much, Somik. This is really, really fascinating, and I'm sure there's going to be lots of comments and questions on this. I myself have a few, but let's move on to the second presenter, to Gabriela. Gabriela, let me ask you, if you can please reflect on the challenges with hotspots and new waves of concentration that you have witnessed in the city of Guadalajara and their surroundings where you actually live and work. So over to you, Gabriela. Thank you.
And thanks for the invitation. It's too important to share with us the experience of Jalisco. I want to share a little context of Jalisco with us. Jalisco, located in western Mexico, with a population of more than 8 million, the state is one of Mexico's most crowded in the country. Not only the urban region of Guadalajara, is my city, is the second only in terms of population to Mexico City. The capital economy is based on manufacturing and information technology. Let's talk about COVID-19 in Jalisco. The first suspect case in COVID-19 appeared on January 22nd. 2 months later, on March 14th, the first confirmed cases in Jalisco, and then more than 6,600 cases and more than 3,100 deaths have been detected in the country. Well, Jalisco is still Jalisco is still at a high level of the first wave of the outbreak. The transmission of the disease being sustained in some areas. The correct decisions and the solid strategy to reduce the spread of the disease have avoided the hospital saturation and consequently the number of deaths. Understanding in which towns the pandemic is moving in the wrong or right direction is critical. That's complex. No single metric can tell the full story in the towns. For example, we have an increasing number of cases in the red area in the metropolitan area of Jalisco in 4 towns. Guadalajara, Tlaquepaque, Zapopan, Tonala. This increasing number of cases in the metropolitan area results more testing or results more transmission or the combination of both. Well, is that the monitoring and hotspots? We have a rigorous daily analysis by the government intelligence team. Has been fundamental to identify geographical areas to high COVID-19 transmission, examine links between social determinants of health like markets, groceries, companies, and these high transmission areas. We examine state level and local level data to make assessments about current risk level and trends, identify hotspots for COVID-19. Specifically, we look at metrics that are really available for all states and towns. Current COVID-19 cases, report cases over the past 14 days. These cases are have the capacity to transmit the infection. We have a hexagon in this map. Each hexagon shows 2 kilometers in the territory, and I have the yellow hexagon on high level of cases, active cases. Well, hotspot indicates or is useful for the government to indicate to public health officer where the disease might surge next. The support local governments implement restriction measures in areas, and seeing the results might also help people be more engaged. The two report their decision to keep a social distancing while pressure is building to relax precautions. We have this map. In this map, we show us some areas in red that have high actually cases, active cases, and in blue I have low cases, and with neighbors are areas in this case. This is the work we have in the monitoring and the prediction and hotspots in local town to take better decision in health.
Okay, thank you so much, Gabriela. So what we will do now, I think my colleague Lauren might have some issues with her audio. So let me take over again, and let's move to the second round of leading questions here. So let me get back to Somik. following the panel discussion. So Somik, I think it's really interesting the model that you have developed. I believe one of the key challenges that cities may face is actually in the use of the model itself. So perhaps you can explain a little bit of what is the type of inputs in terms of data and cost that will involve to deploy a model such like the one that you've described. But more generally, Somik, based on your observations, I wanted to ask you, like, as cities have to prioritize the vulnerable communities while being conscious with their limited resources, what would be the recommendations that you will offer to policymakers on what would be the best way and perhaps the most effective way and affordable way, in a way, to predict and monitor these hotspots? So back to you, Somik, please.
Thank you, Uri, and I hope you can hear me. There are no technical issues here. Listen, I think that's a really important question that you raised, and the reason. Let me take your question into two parts. First is, how can cities best use the methodology that we have developed to roll out in their own localities and to build the capabilities for that. And what I've been really happy to see across countries, particularly in Asia, is the high levels of technical capabilities in many local governments to use spatial data and to translate these data into meaningful actions. An example here is the work we've been doing in the Philippines with the local government department, and this is in collaboration with our World Bank colleagues. And what I've seen is that some of the best ever data I've seen on spatial granular infection tracking has been done by the government themselves. And when we started talking to them, the combination of their data on local sources, along with our global data on building heights and population densities and access to amenities, really allowed for a very good combination in which we could join forces to work towards predicting hotspots. And there, the government colleagues were very keen to also anticipate what's likely to happen. And it's important to anticipate because it's no point just reacting after the infections have taken place. It's to systematically use information on what I call economic density to see what are the most likely places we could have a spread of COVID-19. And how do we proactively and early allocate our civic resources towards that. So that's a very good example. So the key here is information and the capabilities to use the information in a meaningful manner. And I think what we are offering is global public source data that I would welcome all our city colleagues to reach out to us through your World Bank contacts maybe, or directly to us, because the data on where people live comes from globally sourced data, and we're very happy to share it with you. In the next couple of weeks, you will see there'll be a global online platform where you from the city can go and just download these data yourself. In addition, we have very detailed data on public amenities and public services. Again, these are global, and if you think it's useful, then you can just ask us, we'll be happy to share it. The third part of the data, which distinguishes contagion from livability, is the data we put together on building heights. This is very new, and I think it's cutting edge, because for the first time, we have the technology, thanks to the generous support of the German Space Agency, to measure floor space that people live on. So think about, people living on 10,000 people per square kilometer on one-story settlements versus 10-story buildings. The amount of floor space everyone has is different. And I think getting this data into your planning process would be important. We have data for about 450 cities, and we would be happy to share with you the processed information that can help you in your planning process. If there is more need for such data, please do write to us so we can then have a conversation with our counterparts in the German Aerospace Agency, who are very, very keen to join any effort to support city responses. Now, let me turn to the second question, Uri, that you have. Let's look a little beyond. COVID-19 is one of many stresses that our cities are going to face. And it's not that just a viral transmission of this sort is unique or new. So going forward, what we have been thinking is that if you have resource constraints, what are some simple practical policy steps you can follow? The first thing our colleagues know in the city government is we need to think about planning, providing, and protecting public space. Because if you're in a middle-income country environment, it's unlikely that you'll have massive upsurge in private consumption of housing because people are spending a lot of their household expenses on food and other amenities. So public space is really important. And what you saw in a city like Mumbai was that there was a nature park that was well preserved. It's called Goregaon. And that gets about 20 million visitors every year. And it's really a beautiful nature reserve in the middle of a really dense city. But as the coronavirus hit, the city government worked on transforming that whole nature park into a quarantine facility. So, there can be multiple uses of that. And I think these are simple solutions. If you look at a city like Bogota, you go from a low-income country like India to an upper middle-income country like Colombia. Bogota added about 100 kilometers of bike lanes to its already existing public network, and it's closed a lot of roads to do so. The second point I'd like to make is our city planners, our colleagues, we need to be at the vanguard of regulatory change. And by regulatory change is that often, Uri knows this very well, he has worked in India. You look at cities like Mumbai, why are they so, I would say, short, right? And it's because regulations prevent the investment in capital that allow for density of structures. And as a result, people have to really live in crowded accommodations. And just getting the right kinds of regulations to encourage density will be important. It doesn't cost a lot, but it takes a lot of planning and policy will. The third thing I've learned over the last few months is an example from Indonesia. And that's Indonesia's Kotaku program, which is for folks who are not from Indonesia. It's a slum upgrading program. And they have really been implementing COVID-19 protocols in construction work. And the reason they could get such capabilities into their system is that the local slum upgrading efforts was not only about services, but allowed for complementary capacity building in financing and skill development. So now when the time comes, the whole program can be repurposed to also respond to these crises. And I think if you look at Argentina, cities like Buenos Aires and the Barrios 31, they are strengthening, social and urban policy. So we really need to be thinking about it. Finally, I have a point that as urbanists, we really need to be making a case for. That's to have secure land and property rights. This pandemic has taught us one thing, right? It does not spare the poor, it does not spare the rich, it hits everyone, right? And the only way we can defend against such a pandemic is for cities to be able, for residents to be able to invest in upgrading their own structures. And these upgrading processes don't happen unless you have secure property rights. People have no incentive to spend their life's earnings and kind of incomes into assets that can't be protected. I would really encourage us, let's use this opportunity as city leaders that you are to let's make a case for big reform, because this is not going to be the last time a big crisis strikes our cities. Okay, I'll stop here, Uri, and we can talk further.
Fantastic, Somik. Thank you so much. Turn over to you if your audio is working.
Let's see. Maybe the third time is a charm. Hello, colleagues, and I'm so sorry for the audio problem earlier. In many, many weeks of doing this, I have never had problems speaking to you all, and tonight was that night. So let me, without further delay, ask Dr. Anna a question. And that is, considering the need to protect the economy, many other cities in our different regions have decided to reopen. And that is despite a high number of cases. How is Guadalajara and Jalisco balancing this need while still protecting health and the community?
And cases in order to modulate our intervention. If the patient exceeds a certain threshold, we will move to activate more demanding restriction in the activities already open so that the economy of the state will remain. In March, Jalisco government has established the plan COVID Jalisco 19, which includes strategic actions such as reconversion of the hospital for the attention of people with COVID, voluntary isolation centers for people with asymptomatic or mild symptoms of COVID, a platform of the Integral System for Economy Reactivation, called CIRA, as a strategy of the gradual and systematic reopening of economic activity. This is a permanent and continuous link of communication with each of the work centers. We used to testing employees in the work centers and health protocols for the safe return to economic activities, taking account their particularities and support to the citizenship is the period to isolation, like programs of mental health, economic funds, food, among others. What is the main future in Jalisco? Well, we have a strong coordinated government that applies comprehensive strategy and communicates clearly and directly to the community is very, very important. Then we are focused in containing transmission and reducing mortality, the most important thing in local government, and empower a community that takes personal behavior steps to protect the others. Is one or three things to main features in Jalisco.
Thank you, Dr. Ana.
Lauren, sorry.
Did you want to add on to that, Somik?
Yes, if you don't mind if I do, right? So just a point. I think the question you raised is really fundamental because a lot of our city leaders are facing challenges on unlocking the economies. So if you got to make a choice, I mean, for most people living in a city, there's a very difficult choice they're making, right? Do I stay at home and be safe, or but then most of my family will not have enough food, or do I go get some work and get the risk of infection? An example I'd just like to share, if you give me 1 second to the sharing screen, is the example of Medellin in Colombia. And they really came up with a very nice strategy to look at the economic risk associated with different sectors and the economic value of opening different sectors. So they got very granular in their response, and I'd be happy to send that around, just that example, if people are interested. Thank you.
Are you presenting you have a slide on the Medellin case?
Oh, now I got some sharing rights. So give me 1 sec. I will just put it up. It just will take 1 second.
Thanks.
I hope you can see this now. This is what the city of Medellin is looking, has divided the city into different areas and looking at activities by area and by sector, and trying to see, if you look at the left is a measure called location quotients that tells you a little bit about a different activities, contribution or participation to the economy. And the panel on the right that tells you about the measure of economic activity, but penalized by health risk of people coming together. And the blue areas here would point to high potential areas for opening up with lower risk. I think this is really insightful way of making priorities, and I just thought it would be worth sharing. Thank you.
Thank you so much, Somik and Gabriela. I think you've raised very relevant points. There's a couple of interesting questions coming up from the audience. There's one that either of you can take, but I think it's directed more towards you, Somik, which somehow you have touched, I guess, in both your presentations. You underscore really one of the most fundamental issues of this pandemic, and I think this question summarizes very good what the issue is. So let me just read to you what the question says. It says, to which extent the pandemic has pushed city officials to rethink their broader urban policies and actions, for example, in slum areas or hotspots? Have you observed any change in policy direction to ensure that these hotspots are better planned, or at least better prepared for future emergencies? So let me just add one spin on this question, which I have, and it was discussed in a previous session of the series as well when we talked about densities. Is that in many cases, as I think you were alluding at the end of your presentation, Somik, in a way, the pandemic is somehow giving an excuse, perhaps, to city officials to address more fundamental and structural issues in which the cities are being planned. You mentioned the issue of densities, you mentioned the issue of slum formation and the like. So this is more or less what this question is all about. So over to you if you can share some thoughts on this, Somik, and probably Gabriela, if you also want to add after Somik, please feel free.
So thank you, Uri. That's a really good question, and I would just make one caveat to that. I wouldn't see this as an opportunity for city officials to use COVID-19 as an excuse, but more as an opportunity to put in place a longer-term development trajectory. If all of us know that if we were to look at the financing constraints in cities, right, there's $1 trillion deficit on infrastructure finance only in African cities. And there's a big issue of land management and about coordinating infrastructure. So perhaps given that most of national policy attention is often on anything but cities, and often national policy goes at odds with city development for a variety of reasons. Maybe it's because other macro issues are important or rural development issues are important. This pandemic has really focused the attention on cities. So in terms of specific kind of ideas, I think what I was really struck at how quickly our city leaders have been able to respond in terms of seemingly small policy changes that I think will have a long-term impact. The first year, if you were to think about cities, many cities, especially if you live in the US or you live in, especially in the US, lots of cities are just freezing monthly rent payments. And often when you see about adversarial relationships between city governments and moderate income clients or moderate income residents, this seems to me like finally there's been a lot of pro-inclusion sort of efforts. In Colombia, in response to COVID, in fact, the city governments have frozen the increment in the monthly rent payments during the quarantine to most low and middle income residents. And they have really developed a framework for mortgage grace periods. And this really allows us to have a better sort of political conversation, a more saying agency court conversation between tenants and landlords. And we've kind of think about a way to create rental housing subsidies for poor household families that now they're short term, but these are part of a policy conversation that we typically do not have. Even if you look at move from formal housing to informal housing, you see squatter settlements in Buenos Aires that were now allocated property rights. For some of them, that property right allocation has substantially increased housing investment. It has reduced household size. It has improved education of the kids relative to those without property rights. And I think governments are starting to understand that. And in a lot of cities, I think, even I've seen some ideas about regulatory change, like in Sao Paulo. There has been moves to reduce floor area ratios with higher zoning minimums rather than maximums in different areas. So I think from a large range of policies, I think city governments are doing intermediate measures. In the long term, I think, especially for most of our clients and our partners on this call, we need to think about land management very carefully. And if you were to look at the Economist magazine of September 12, I mean, that the lack of clarity in property rights and land management, I think, was seen to be one of the biggest hurdles for cities to raise or to be able to raise capital investment and household investment in structures. So I think the issues have been brought to the forefront. Some cities are doing short to medium term measures because we haven't emerged from the pandemic. We are still right in the midst of it. But I'm very hopeful that this is the right time for action for most of our clients and most of our colleagues who are leading city actions. Thank you.
Thank you so much, Somik. I have another question here for Gabriela. And that is, what other aspects will be associated with this gradual increase in the mobilization of population and economic activity? What is it that we can expect to see?
In this moment, it's very important to think about the reincorporation of academic activities. Will increase the risk of transmission, the virus transmission to the population over 60 years old by carrying the child population. In Mexico, the grandfathers are in some parts care of child, and this is an increased risk for this to reincorporate academic activities. As a result of population mobilization, additional should be given to have factor risk different from this study now, which may represent a greater probability to complication. We have seen the renal disease are a big important comorbidity in young people to have mortality. We have additional different disease burden than COVID-19 delayed in their care by the health emergencies, which represent a risk of saturation of hospitals in a short term, like surgeries, like another disease. The progressive lifting of the restrictions will imply a greater risk of disease transmission. Well, COVID is the opportunity to monitoring and tracking applies to other diseases to establishing health policies. In Jalisco, epidemiologic monitoring is fundamental in different diseases such as dengue, flu, and now obviously COVID to identify risk areas and implement public health, but local health.
Thank you, Gabriela. And I like that you turned those aspects into opportunities as well for Jalisco. What more can we learn? What more can we do? And I think that's been a common theme coming out of this data. What can we see and what kinds of progressive changes can we make based on these learnings? I think you're also pushing the audience to think in this way. So it's a very common theme. Would you like to also weigh in on that question?
Lauren, I'll have to ask you to restate the question. I couldn't really hear it first time around, sorry.
Oh, absolutely. So what Gabriela was just talking about was what other aspects, when we see the cities opening up, what either risks or opportunities can we see from the increase of activity and that reflection on being able to look at movement and then increase tracing, increase tracking, helping identify other kinds of diseases and actually highlight other kinds of issues to address.
So maybe, Lauren, I'll take a different tack to responding to this question, because I'm not a health specialist and I don't think I should be, providing much of a commentary on that. But the opening up of economies, I think the whole weighing the risk probability of infection versus the economic dividends from opening up is something that cities can do when they have good information on the local economic structure, where the jobs are located, in what sectors the jobs are located. In Mexico, as Gabriela would know, they have excellent data on monitoring economic activities at a very micro level. And in places where they have reasonable testing, one could make these risk metrics. But what I have seen more broadly, and some of the work I'm doing in India, is one of the unintended consequences of the lockdown has been a complete freeze on trucking and transportation services within a country. And in places like India, the large cities, they form a major part of the trade and transportation network and all the trucks basically they kind of originate from these places. And even though the lockdowns did not focus on very particular, were not covering basic commodities, we find that the price of commodities in urban markets have increased by 12 to 15%. This has a huge impact on the vulnerable group. But also importantly is that it's become, as you go further from a city, and I'm sure Gabriela can talk to that, go to the rural areas, the price increases and the shocks there are really high. So I think we should be putting a little more focus and looking at the transportation sector linked to the urban sector as well. Thank you.
Somik, there is an interesting question that came in. I think it talks more towards the model that you presented right at the beginning, which I think is interesting. It says, thank you for your presentation. In addition to where people live and how they can access services, toilets, and the like, I believe it is important to understand where they are visiting during the day. What methods can you apply to capture such dynamics? So I think this refers more to the mobility of the dwellers living, go work and come back. I think it's an excellent point. Over to you.
So this is an excellent point, and I think there was another comment on the chat box by a colleague named Taka that talks about measuring how people are accessing public toilets, right? So our model is static and does not include daily mobility patterns. There are complementary activities of the World Bank tracking mobility, working with data providers like Cubic and others, and with Google, where you can either track cell phones or other sources to look at mobility patterns. What those data show is that mobility patterns for the rich have dramatically declined following the lockdowns because they can substitute office-based work with home-based work, and they can get many of the amenities brought home. But if you were to look at lower income groups, mobility reduced for a while, but then people just had to go out to either access basic amenities or to get to basic jobs, right? So our model does not do that. It's a contagion risk probability model. And what we have found in countries like the US, Philippines, and South Africa is that they track the real rate of infections and incidents quite well. So in the Philippines, for example, we have a complementary effort where we can predict 2 weeks out in time, down to the barangay level, what's going to happen in terms of infection rates. And that pretty much follows the same rubric of looking at densities, looking at access to services, and where people live. So these are all complementary measures, but I really appreciate the point on mobility, and I'm sure we can connect you with the folks at the World Bank who do that work.
So I think I'll start to bring our panel to a close because we're nearly at time here. I want to start by thanking both of our panelists, Gabriela and Somik, for your presentations, for sharing very openly about your learnings from the COVID-19 crisis and giving very tactical and very practical insights to the attendees and offering to connect them to continuing resources and learning. I also want to thank all of those on the line. Thank you for spending your morning or afternoon or evening with us. We know that there are a lot of different kinds of webinars and series that you could be part of, and we're glad that you're here with us. For our next session of Cities on the Front Line, we will be meeting in 2 weeks on Thursday, the 8th of October, and we will be looking at risk and crisis communication. We're going to be hearing from two very interesting and very different cities, from Singapore, where Uri and I are sitting, and then also from Ramallah in the Middle East. So I hope that you will join us, and until then, stay safe and stay healthy. Thank you all very much.
Thanks very much.
Thank you.
Goodbye.